So, a virus that causes a pneumonia-like illness grabbed the headlines late in December 2019, it's last year. At that time, little was known about the disease itself. Fast forward 4 months later, the novel coronavirus has had a hand in over 50,000 deaths. Reportedly, over 1 million people have tested positive for COVID-19. Still, there are so many questions that people have about this disease. So we thought we'd invite Professor Helen Rees, Chairperson of the South African Health Products Authority, to help us better understand the basic facts of this outbreak. The good professor joins us now via Skype. Professor, thank you very much indeed for your time.
Not at all. I'm happy to talk.
Look, we need all the help we can get. We are asking our viewers as well to send in some questions that they might have with regards to COVID-19. So I'll be now and then referring to our tweets that we've been getting. But let's just get the facts and test the plan, Professor. The question at the end of 21 days will no doubt be how long more? And I guess the obvious answer will be depends on where we are in the fight. But what numbers, what data would you be comfortable with for the president not to extend the lockdown?
Well, as you say, that's going to be very difficult to estimate. We know that the numbers at the moment seem to have flattened a little bit, which is very encouraging. But we don't know if that flattening is because people don't have transport, so they're not accessing clinics, or in some places there are insufficient tests. We want to do many more tests. We can't do as many as we like. So we can't actually understand at the moment what that flattening means. And so at the end of 21 days, we'll have more data, we'll have more tests, we'll be mapping the country quite carefully, right down to sub-district level, to try and see what's happening and to try and see if we can find hotspots. So in fact, you're quite right. Until we get to that point and we have the data available then, whether we have to extend nationally, whether we have to extend in hotspots, we'll have to wait and see.
Speaking about the flattening of the curve and I guess the slower increase of positive COVID-19 cases that has been recorded, the health minister was talking the other day, speaking about the lockdown, speaking about, forcing people into quarantine, those that are coming into the country, as some of the reasons given in order, for the flattening of this curve. You agree it plays a part?
Well, absolutely. We know that the first wave of infections that we saw were people returning, particularly from Europe and the US and the UK. And so by actually being quite strict when people returned, as we saw with the young people from Wuhan, by actually enforcing quarantine, you're going to control spread, because that was where the first wave of infections came from. So we've seen a decrease in that now. But when people return, the importance of isolation and being very cautious, assuming that you might well be infectious, even if you're asymptomatic, and taking those 14 days, being very careful to isolate yourself from your family if you can, that remains incredibly important. So I do think that this has had a part. But now we're looking into the next sort of phase of the outbreak, where we're starting to see transmission within the community.
Okay, Prof, let's dig a little deeper. Let's get to know more about this disease and its effects. Symptoms, we know about fever, we know about cough, shortness of breath. What about sudden loss of smell and taste, tummy issues? Are these symptoms as well?
Yes, they are. They're not as common as the cough and the shortness of breath and the fever that you've mentioned. And headache is also another symptom. But loss of smell and loss of taste are certainly documented. And if you do have those symptoms, that should immediately alert you, because those are quite unusual symptoms in the absence of, say, having a very heavy head cold.
Yeah, I'm just looking at a tweet now from one of our viewers, Sahwate, and he's asking, with regards to the coronavirus symptoms, he's asking, does someone have to experience all combined or just one of these symptoms? And he's asking in particular with regards to the lungs as well, if it attacks the lungs first.
Normally, in the sort of what we're starting to see as what we call the natural history of the infection, the lungs would come a bit later. And these other symptoms would come first: fever, headache, cough. But the severe problems we see with the lungs come a little bit later, but they can become very severe and quite quickly. The answer to the question is, do you have to have all the symptoms? No, you don't. And this is one of the difficulties with identifying cases, is that you might just have one or two of those symptoms. And this is coming into the cold and flu season, so those symptoms also go with cold and flu. But under these circumstances, we're going to have a very high level of suspicion. If you don't feel well, fatigue is a very common symptom, tiredness. People report sleeping very long periods, muscle aching. If you have those symptoms, even if it turns out to be flu, you should actually first say, could this be COVID-19? And you should seek advice.
Because, it could be confused, as you said, with the normal flu-like symptoms, and we're approaching the so-called flu season. So you say seek medical help, even if you just, have a hunch that you might have COVID-19.
If you've got one or two of those symptoms, there's a hotline, the NICD hotline that you can phone, and clinics are setting themselves up, and GPs, so that you can phone. Or if you the way that you get your healthcare is to a clinic, clinics are setting themselves up so that if people present with symptoms, there's a separate screening process to separate people before everyone goes into a crowded clinic, but that we don't want. So there's a separate external screening process where people are asked questions. And if your symptoms are suggestive of COVID-19, then you'll be put in one group, and other people who perhaps are coming back for their diabetes, etc., will be put in another group. That's the intention at the clinic level.
Professor, what about a mother-to-be who is watching now and is concerned? Can the virus be transmitted from the mother to her baby during pregnancy?
Well, this is a really understandable concern. I mean, any pregnant woman would be thinking, what does this mean? So far, from what we've seen in China, we haven't seen particular concerns around the virus being transmitted to the infant, but we're monitoring this all the time. The other thing we haven't seen, but we're still going to be very cautious and keep looking, is a higher what we call mortality rate, a higher rate of death amongst pregnant women. Some viruses, you do see this, that pregnant women are particularly vulnerable. So far we haven't seen this, but in South Africa we are monitoring that very actively just to make sure that pregnant women are not at higher risk, nor their infants. But I think the same goes. If you're pregnant, for you, be very cautious. You don't want to get any viral infection if you can help it. Particularly if you're pregnant, then really respect the lockdown. It's important for you.
Prof, you were talking about what we've learned from China, and I guess they've made so much progress in the fight against COVID-19 that, it talks to what can be done at a policy level as well as a clinical level. We've got a tweet from one of our viewers, Mr. Omulu, and he's asking, how come the Chinese are now almost free from COVID-19 while the rest of the world is still suffering from it? What do they use to treat their citizens that countries like the United States can follow?
Well, it's in a way less about what they have done for treatment and more about how they responded to the outbreak. I think on reflection, they would have liked to have responded even earlier. But nonetheless, they put in really strict measures pretty early on, and they made people stay at home. And that lockdown is not lifted. It's partially lifted now, but they're still being very cautious. So by doing that, by reducing the numbers of cases, that means that the number of people who are infectious in the community goes down, the number of people they infect goes down. And as you push that number down, which is what we're trying to do, if you can push it down and down and down, eventually the virus will just die out because it's not able to replicate itself in enough people. That's what the idea of a lockdown is to say, let's push down that number of cases so that the virus can't sustain itself. What China's now grappling with is people coming back into the country. And again, many of the cases they're now seeing are from people who've been outside China who are returning. and bringing the virus with them. So they're also having quite strict quarantine rules for people who are returning from outside the country.
Yeah.
That was really what China did more than anything majorly different around treatment or prevention. They did this very drastic, strict lockdown. That made the difference.
And to follow on that, I mean, the basic mission of the lockdown is to stay apart. If you stay apart, the virus can't be transmitted from one person to the other. Following from that, and I know I asked you this before, but we keep on hearing this more and more. People are confused as to whether to use masks or not. If everybody in the country, all our citizens, all over 50 million or so, have masks, no one will get the virus, correct? But this is the issue, is that we are short of masks, certain types of masks, correct?
Correct. So as you know, the first guidance that we have for wearing masks are these special respiratory protection masks that we want the healthcare workers who are highly exposed to wear when they're looking after people with proven disease. The second one are these what we call surgical masks, which we want people with infection or with suspected infection to wear. Now, the problem that people are grappling with is the following, that many people with this infection are going to have minor symptoms or be asymptomatic. So they won't know that they should be wearing a mask. So, and if you're in a crowded place, which is why we don't like crowded places, if you're in a taxi and you don't know that you've got the symptoms and you're not wearing a mask, then the possibility of spread is there.
Right.
And so at the moment, the World Health Organization is grappling with this, and so are we in the country, to say what would be the next step. And that's why you're seeing a lot of people saying, well, makes sense to make our own masks. Should we do this so that when we go out, if we have to go, for example, on public transport, that we can at least wear that? The one thing I would say, though, is just be careful that wearing a mask doesn't necessarily protect you, because when you've worn a mask, you take the mask off. If there's something on the mask, you take it off. It's on your hands. If you have something on your hands and you touch things and the virus is there, you can spread it. So if you take the mask off and you put it on a surface, and there's virus on the mask, you can actually contaminate a surface. So wearing a mask per se isn't the end of the story. If you wear a mask, you've got to stick to the very strict rules about hand washing and being very careful how you dispose of that mask afterwards.
Right. So following the normal hygiene protocols is key in this regard. Let's talk about, you mentioned if somebody is asymptomatic. I want to talk about testing in this regard. If one gets the virus but is asymptomatic during the course of the virus, will future tests show that you once had the virus?
As far as we know, the answer would be yes. That if you've had the virus, whether you've had symptoms or not, your body will have mounted what we call an immune response. That's the body's way of fighting off an infection. After a couple of weeks, we're able to detect the antibodies, which are the special molecules that fight the virus. We're able to detect those in the blood. So whether you've had asymptomatic or symptomatic infection, we should be able to detect that. And in time, that's going to be really important, because as the epidemic progresses, as you can imagine, more people will be exposed, some with symptoms, some with minor or possibly no symptoms. So by being able to map people's antibody responses over time, we're going to be able to see if we have hotspots. At the moment, however, what we're still doing, and we want to continue to do, is to detect the virus. That's how we detect infection. And that you can do very quickly as soon as you get an infection. Antibodies take time to form. So if you only depend on antibodies now, you're not going to be able to detect people with acute infections.
So assuming there's immunity to this disease, is there any test that will show that you are immune for the future?
We don't have those tests readily available in South Africa, but at the moment, both SAPRA, which is the regulatory authority, and the Department of Health are pushing very, very hard and fast to get those tests in. These are going to be tests for antibodies, and they're what we call rapid tests, so they can be done much more quickly than the lab-based tests that we currently are going to do. So once we get those in, we will have a strategy to use them in the community, but everyone must be very careful about how you interpret them.
Yeah.
If you have a negative test, it doesn't mean to say you haven't got the infection, nor it could be that you're just too early, you haven't formed antibodies. So having a negative test is not a sign that everything is okay. And you must be very, very cautious about that. We're also aware that people are starting to advertise online for these tests. These are not necessarily validated tests, and unless the test is of good quality, that the regulatory authority has approved for South Africa, be very careful, because there will be nothing worse than you, for example, in your family, getting a test online saying, I've got symptoms, but hey, I tested, I'm okay.
Yeah.
And then you spreading that infection to people who are particularly vulnerable, the elderly or people with other conditions.
Yeah, that's the danger, isn't it? I want to get some, better understanding with regards to the relationship between COVID-19 and SARS, and some of the lessons that we learned from dealing with SARS that we can use, during this COVID-19 pandemic.
Well, SARS, as you know, was another coronavirus, and had a very significant outbreak in China and Hong Kong and in a few other countries in the Far East. Because it was a coronavirus, people started to look for treatments and therapies and for vaccines. So one of the things we've been able to do in response to the lessons learned from SARS is to look again at what kind of therapies seem to have an impact, and where were we with vaccines? Can we pull some of those vaccines off the shelf and repurpose them for COVID-19? So that's one set of learnings. The second set of learnings was, in fact, what you saw China doing. So what we saw China doing was exactly what they had learned from the SARS epidemic, which was, we're going to shut this down, and we're going to shut this down quickly.
Right. Prof, I just want to remind our viewers now that they can call in if they have any questions with regards to the novel coronavirus. So we'll put up that number on the screen. It's 078 799 4480, 078 799 4480. We have the expert with us here, so it's your chance to ask the good professor some of the questions that you have with regards to this virus, this disease. It is a very determined disease, a very disrespectful disease, as we've been saying. It doesn't care about borders, where you live. It affects everybody equally, so to speak. So the opportunity to affect is equal in that regard. Professor, I just want to talk about when one is quarantined. If two people test positive for COVID-19 and they live in the same residence, do they need to be quarantined separately?
No, if you're both positive, which is quite likely in households, then you can quarantine together. But if, and this is not at all infrequent, one person in a household is positive and others are negative, then the household has to be extremely careful to really isolate that person. That means that the person, if you've got the capacity to have a separate room, that other people mustn't be going in and out of that room, that when food is given, it must be given at a distance, that you have to be very careful how you wash dishes and wash clothes. All of those things have to apply in the context of the household if only one person is positive.
And there's a spectrum of severity here, isn't it? Because we know that the vulnerable are the older folk. They are more, affected more severely in this regard. But younger people as well. I mean, they're not off the hook here in this regard. The WHO was telling us that data from countries show that people under 50 make up a significant proportion of people that are hospitalized. What about children? They seem to have a greater resilience, I guess, to COVID-19.
That is correct. And so far, even in Europe and the US, where we've seen that children have been victims of this virus, and very often they've had other conditions that have made them particularly vulnerable. But it certainly does seem that children seem to be relatively protected. We don't know whether that's because they're exposed as children. They get a lot of coronaviruses, lots of coughs and colds, all of those running noses. So they're exposed to a lot of this family of viruses. We don't know whether it's that or whether it's actually something at a molecular level in the lungs that might be giving them some level of protection when compared to other groups of people.
Right.
You're right about older people. but you're also right about younger people. And I think that's one of the messages we have to get out to everybody is just because you're young, you're not protected. We have many, many young people in this country. And even if the percentage who get the virus or get very sick is lower in that group, even if that is the case, because we've got so many young people, we should expect that young people will also get this infection, will also get sick.
So let's talk about everyday realities. People are going out in the mornings or evenings to buy groceries. Should you be sanitizing groceries when you bring it back into your home?
Yes, you should. Because groceries are a surface, if you think about it. We keep telling everyone surfaces and we think about our tables and our chairs. But actually, groceries are just another form of surface. And remember that those groceries have been, they've been transported, they've been put onto shelves. Other customers might have picked them up, changed their minds, put them down. People could have been in the aisles and sneezed or coughed. Particles in the air settle. So if you can sanitize, if you've got tins or packets of washing powder, if you can use just a mild soapy water to wipe those, that's ideal. If you don't have access easily to things like that, then leaving the packets outside away, and so nobody touches them for up to 72 hours will also be an alternative. Ideally, though, if you can wash them, wash all your groceries, everything, including the things you put in the fridge, just assume that they could have virus on them and just be very careful.
Right. I want to talk about any long-term effects from COVID-19 and what we've learned so far. Can the virus have a long-term effect on your respiratory system?
Well, obviously, as I say, we're learning all the time, but it would seem that some people who get very severe respiratory disease, for them, it might well have a long-term damage to the lungs. But this is something that we're going to have to look at. Other people will have, it can affect the organs more generally. And again, if you're very severely affected and you survive, then there will be a need to monitor all of those organ functions over time.
Right. If you contract COVID-19, Professor Rees, will your seasonal allergies impact on your response to the disease? Many people suffer with these allergies. What's your take on that? What's the data saying?
It's a good question, but so far I haven't heard anything to that effect, and I don't think that we would expect that would be an issue. Yeah. Having an allergy that causes something like asthma, however, is an issue, because there you have your lungs that are affected. But people who've got, sort of allergic rhinitis, so far I haven't seen any data that would suggest that you're more at risk to get COVID-19 infection.
Right. So if somebody has asthma, for instance, and they test positive for COVID-19, they need to seek medical help immediately, isn't it? They can't rough it out at home. Is that what you say?
Yes, anybody who's got any of these conditions that you've heard a lot about now that might make you more vulnerable to both getting the infection but having more serious consequences if you get it. So things like lung disease, asthma, diabetes, high blood pressure, heart disease, situations where your immunity is compromised. So people who have cancer and are on treatment. We don't know yet about HIV, but we do know that people living with HIV are more susceptible to seasonal flu. So we would want you to be very careful. It's particularly important for people during this time, if you're HIV positive, to be very careful about continuing to take your antiretrovirals, because that really is a protector of your immune system. So a big appeal to everyone out there is to say this is the time to be really careful about daily dosing and not forgetting any doses and getting supplies from your clinic in time.
Prof, I want you to paint the picture for us from what you've understood about how a person, I understand COVID-19 will affect people differently. It depends on your immune system and your body, et cetera, but what's the typical day and night for somebody that has contracted COVID-19? What do they go through?
Well, the stories I'm going to say are things that my friends have said or things that we've read. They obviously are the best people to describe it. But it does again depend on your severity. I mean, for some people, it's things like just fatigue, muscle aches, but nothing more than that. Whereas other people find that they are completely exhausted and sleeping, that the headache can be disabling and really affect your ability to concentrate, that the cough can be really so bad that you get paroxysms of coughing. And this can go on for, I mean, if you have moderate disease, this isn't a few days. It can go on for a couple of weeks before resolution. So this is quite a debilitating disease if you get it moderately, and obviously if you get it severely.
And it's one of the questions that one of our viewers are asking on Twitter, Disang, with regards to just basically roughing it out at home. Because there's no medication for this, isn't it? There's no vaccine. We know you spoke about this, that the trials are continuing. But currently, what do you do? Do you have, for instance, the general flu medication that you normally take? What do you take when you're sitting at home, self-isolating, and you have COVID-19?
Well, at the moment, you're quite right, it's symptomatic treatment. So what we're recommending is paracetamol. Rather than anti-inflammatories at the moment. So paracetamol would be the thing for your headache, for your aches and pains. And then making sure that you have plenty of fluids. You'll see that quite a lot of people with the fever will sweat quite a lot, and that means that you're going to get at risk of dehydration. So plenty of fluids. If you can eat, we also have seen sort of patterns where people will feel a bit better and then go into a slump again. Yeah. When you're feeling a bit better, if you can eat, then that would be good. Otherwise, it is symptomatic. And rest, don't try and fight it through. If you need to sleep, just lie down and sleep. That's the best thing to let your body heal itself.
Right. Professor, we are inviting callers to, ask you, the expert, with regards to any questions they have about COVID-19. The number is 078 799 4480. We have Spamandla on the line. Spamandla, very good morning to you. What's on your mind?
Yes, hello. How are you, sir?
Very, very well.
Hello, how are you?
What's your question? We've got Professor Helen Rees here. Tell us your question.
Yes, I wanted to ask the doctor, if you've been diagnosed with the COVID-19 and then the body recovered and developed the antibodies against the disease, will you be able to, is there a chance for the infection to recur again?
Good question. Thanks, Commander.
Yeah, very good question. What we understand at the moment is that when you have antibodies, you will be protected. What we don't know is how long that will last for. Whether it'll last you for a year throughout this outbreak, whether it'll last you a lifetime, that we don't know. And so all the time we're trying to build up our understanding of this. But our understanding certainly at the moment is if you've had the infection and you developed antibodies, that for now you should be protected. Right. And that's clearly something that's going to be in the long run a big advantage for people who have recovered and for the community, because there'll be more people in the community who build up resistance to renewed infection.
Spamandla, thank you very much indeed for that call. I mean, speaking about the long run, Professor, do you think COVID-19 will end up being a seasonal virus? What's the likelihood?
Well, I think that is the view of many experts at the moment, that what many countries are seeing is a first wave and then a second wave of infection very often. So you get through this first wave, numbers go down, but then you'll get potentially a second wave because people start to resume normal activity, and then the virus has a chance to reestablish itself. But I think that the view of experts is that there's a significant chance that this could become a seasonal virus, particularly in parts of the world where there is a definite cold season and a warm season. Right. Coronavirus is like the cold. And so there's a significant chance that this might then establish itself in outbreak patterns in a seasonal way. It's for this reason that we think it's incredibly important to get a vaccine, because a vaccine is the thing that would then be able to protect the world finally against this really, really threatening infection.
Prof, we've got another caller on the line. Ntate Dlamini is on the line. Ntate Dlamini, a very good morning to you. What's on your mind?
No,
Ntate Dlamini, you're live on the agenda.
I have seen different masks used by people to protect themselves from.
All right, it seems that we are having a bit of an issue with that line. We'll try. Okay, if you can hear us, please could you switch off your television set? It just becomes a bit of an issue when trying to answer the question. Do I have the name right? Is it Ntate Dlamini? All right, it seems that we lost that line, but we'll try to bring that caller back online to ask the questions. Prof, with regards to how South Africa is currently handling this situation, with regards to the messaging that is getting out there, a lot of people are criticizing government for being seen to relax certain regulations. Is it a good idea to ease up certain regulations as we continue to learn and revise our strategy? Or should we be hard and fast in terms of locking this country down and sorting out this virus once and for all?
Look, ideally, we would all want to be hard and fast and lock down as much as we can. But we also have to recognize that this is going to become more difficult, particularly for people who are living in really difficult conditions, who are requiring a daily income to buy food. So we're going to have to adapt to our social circumstances. As much as we can, we want to lock down and have social distancing for everybody. But we're going to have to make sure that we look after particularly our most vulnerable citizens. Getting food is going to be really, really important, and we're going to have to deal with that. We can't ask people to stay at home if it's impossible for them to get food or to earn a living to get food. So actually getting feeding schemes, getting food out to communities will be very important. But ideally, the longer we can do this, the better. It's also giving us time to prepare. You'll see that the president has made announcements, the ministers made announcements for the community outreach programs. Now, there's an enormous amount of work going on behind the scenes, so that these community outreach programs will be put in place, testing will be there, identification of cases will be there, labs will be there in terms of outreach, rapid tests will be there. We need a bit of breathing space to get all of that in place as quickly as we can. And that's what's currently going on. So this lockdown, as long as we can sustain it, is not only probably giving us a little bit of respite in terms of numbers of cases and hospital admissions, but it's also giving us the time to get all of the other measures in place that we need to get in place.
All right, I think we got a caller back on the line. Professor Ntate is back on the line. What's on your mind? Hi. Go ahead. We're battling to hear you, but let's see if the line clears up a bit. Go ahead, ask your question.
That way, I'm seeing people using to protect themselves from taking this virus. I want to know which the mask is appropriate to use because I'm hypertensive and I'm having a daughter who's asthmatic. So I want to know what mask must I use.
What Tata is trying to say. So we're going to drop this line and try to bring it up again if possible. I just want to get one of the questions asked by Kawe and asking the professor with regards to the spread of coronavirus that was noted in China during December and precautionary measures like the lockdown was taken later. Kawe is asking, is there a possibility, Professor, that the virus entered the Republic during the festive season and the infection was here before we knew it was actually here, before the first case was reported?
So the question is, were there cases here before we identified them?
Yes.
Yes, in South Africa, not just in China.
Correct.
Because we had cases before we could really get surveillance up and going. But having said that, the National Institute of Communicable Diseases was quite on the ball in terms of testing early. And so we were looking for cases before we had cases in South Africa. I think that we were very worried, if you look across the African region, because there's a lot of travel and a lot of business between China and many African countries, busy airports, busy hubs where people fly in and fly out. And we were very worried that we were going to see spread that wouldn't be identified, particularly in countries that are going to struggle to have proper surveillance. Here in South Africa, however, surveillance was being done very early on, which is why we were able to catch those early cases. The lockdown that we've seen, if you compare to other countries, has still been done relatively early, and that is a good thing. As I said, it's hopefully flattening the curve, which is what we hope we're seeing, and it's giving us time to prepare.
I'm just looking at our Twitter page and we're getting a lot of questions, Professor, with regards to masks. One is coming from Neville and asking if masks can be reused if you sanitize them.
Well, it's a very good question because of the world shortage of masks. And at the moment, there is serious work. I mean, to sort of globally to say, can you repurpose masks? And what do you do to repurpose a mask? What would need to be done? It will obviously depend on the type of mask. And the masks that we really are very concerned about, and there's a global shortage, are the masks that we're asking healthcare workers to use. So the answer at the moment is, if you haven't got anything else, then that would be something to do. Leaving outside in the sun for 72 hours, that might be something to do. But there is no official guidance on this. And the ideal will still be to say, using it once and then disposing of it. But just watch that space because people are seriously looking at this now because of the global shortage of masks.
Will bleach help to disinfect it?
Well, bleach, diluted bleach is a good thing to use for surfaces if you haven't got things like alcohol sanitizers, etc. So bleach is a good antiviral agent. And if you wash something in bleach, the chances are it's going to go. But as I say, we don't know what damage that would do to the material and whether, in fact, what you've then got is a very permeable mask. So there is no official guidance on this, and it will vary from mask to mask, but it is something that people are seriously looking at now. And so as soon as there is official guidance, and we're also looking to WHO and other countries for what they're establishing, then that will be adopted and reviewed in South Africa and will come out as guidance. South Africa is also actively, as you know, looking at the mask strategy continuously.
And just finally, Professor, as we wrap things up, what about pets? Can they contract COVID-19?
It's a very good question. So far, and this is in the Far East, in countries there have been 2 reported cases of dogs getting the infection from adults. There's very serious work being done in terms of environmental health and animal health. And one of the things that they are investigating is whether what we call companion animals, pets, are vulnerable. Because, of course, what you don't want is a second reservoir of animals that are going to get infected. But this is, so far, only 2 cases in the world that I've seen. There's active research going into this. So at the moment, this is not something that people are saying that this is a big concern. But again, definitely needs active research, but nothing major at the moment being reported.
So many questions, and we thank you very much indeed, Professor, for coming on and giving us shedding some light on the coronavirus, novel coronavirus. Scientists are learning more about it, and we are as well. So we do appreciate your time and your insight. Be well.
Thank you. Be well as well. Thank you.
All right. So that was Professor Helen Rees, Chairperson of the South African Health Products Authority.